Artificial respiration. It is one of the life-saving procedure. Artificial respiration is required when there is an arrest of breathing without cardiac failure. Arrest of breathing occurs in the following conditions: accidents, drowning, gas poisoning, electric shock, and anesthesia. Manual methods. Manual methods of resuscitation can be applied quickly without waiting for the availability of any mechanical aids. Affected person must be provided with clear air. Cloths around neck and chest regions must be loosened. Mouth, face and throat should be cleared of mucus, saliva and foreign particles, etc. Tongue must be drawn forward and it must be prevented from falling posteriorly, which may cause airway obstruction. Stoppage of oxygen supply for 5 minutes causes irreversible changes in tissues of brain, particularly tissues of cerebral cortex. So artificial respiration resuscitation must be started quickly without any delay before the development of cardiac failure. Purpose of artificial respiration is to ventilate the alveoli and to stimulate the respiratory centers. Manual methods are of two types: mouth to mouth method and Holger-Nelson method. In mouth-to-mouth method, the subject is kept in supine position and the resuscitator, person who gives resuscitation, kneels at the side of the subject. By keeping the thumb on subject's mouth, the lower jaw is pulled downwards. Nostrils of the subject are closed with thumb and index finger of the other hand. Resuscitator then takes a deep breath and exhales into the subject's mouth forcefully. Volume of exhaled air must be twice the normal tidal volume. This expands the subject's lungs. Then the resuscitator removes his mouth from that of the subject. Now a passive expiration occurs in the subject due to elastic recoil of the lungs. This procedure is repeated at a rate of 12 to 14 times a minute till normal respiration is restored. Mouth-to-mouth method is the most effective manual method because carbon dioxide in expired air of the resuscitator can directly stimulate the respiratory centers and facilitate the onset of respiration. Only disadvantages is that the close contact between the mouths of resuscitator and subject may not be acceptable for various reasons. Holger-Nelson method or back pressure arm lift method. Subject is placed in prone position with head turned to one side. Hands are placed under the cheeks with flexion at elbow joint and abduction of the arms at shoulders. Resuscitator kneels beside the head of the subject. By placing the palm of the hands over the back of the subject, the resuscitator bends forward with straight arms without flexion at elbow and applies pressure on the back of the subject. Weight of the resuscitator and pressure on back of the subject compresses his chest and expels air from the lungs. Later the resuscitator leans back. At the same time he draws the subject's arm forward by holding it just above elbow. This procedure causes expansion of thoracic cage and flow of air into the lungs. The movements are repeated at the rate of 12 per minute till the normal respiration is restored.